Okay, good afternoon, everyone. It is 3:15, so I think we're going to go ahead and dive in. Thank you so much for joining us. And I hope that you are all trying to stay healthy and staying during this really stressful time. We will be sending around the PowerPoint at the end, and we will get that to you via email, and it will also be online. And there are also instructions for minimizing our videos as we go through the PowerPoint. As much as I know you would love to look at us the entire time, it does obscure the writing. So please feel free, our feelings will not be hurt if you do. Yes, there are instructions. So you're just gonna click to toggle the panelist video screen off the screen there. So we are gonna go ahead and get started. I'm Robin Merrill, I'm Associate Legal Director at the Human Rights Campaign. And I'm going to send it over to our good friends at SAGE to get us kicked off.
Hi, I'm Michael Adams, the CEO of SAGE, and I'm here to welcome you to today's webinar on LGBTQ older adults and COVID-19. SAGE's only reason for existence is to support, honor, and advocate with and on behalf of our LGBT older pioneers. And this is an especially important time for elders in our community who truly are at the epicenter of the COVID-19 pandemic as a result not only of their age, but of the fact that many are health compromised and many live with very, very thin support networks and in severe social isolation. So we are here to talk with you today and to provide you with resources. SAGE is working with our affiliates across the country to provide support and services for our LGBT elders. It's also critically important that we ensure that they have the protections they need and that we all are understanding of how we can vindicate and enforce our rights. That's why it's my honor to be joined here today with our friends and colleagues from the Human Rights Campaign and Lambda Legal. So please enjoy this webinar, and we look forward to working with you as together we lock arms to ensure that every older member of our community is safe and healthy. Thank you.
Hi, I'm Kevin Jennings, and I'm the CEO of Lambda Legal. I hope my message finds you safe and sound in these frightening times. The coronavirus doesn't discriminate, but unfortunately, there are people in our healthcare system that still do. There must be no barriers for members of the LGBT community who are trying to access quality healthcare during the pandemic. And at Lambda Legal, we are committed to standing with you in making sure you can access the healthcare you need during this frightening time. If you are concerned at all with accessing the healthcare you need and feel that you have encountered discrimination, please contact our help desk, which you can do either by going to our website, lambdalegal.org, or by calling 213-382-7600. Again, that's 213-382-7600. And our attorneys will either give you resources or connect you to an attorney who can provide you with assistance. As we have done for 47 years, Lambda Legal is fighting for you, and we will fight for you now. Please take care and be well.
Hello, I'm Alfonso David, the president of the Human Rights Campaign. There are more than 2.7 million older LGBTQ adults living in the United States. COVID-19 has exacerbated the challenges that LGBTQ people and specifically older people face in this country, from systemic discrimination in housing and employment to discrimination in healthcare. LGBTQ older adults face an increased risk of poverty and social isolation. For example, LGBTQ older people are twice as likely to be living alone and 4 times less likely to have children, which means that older LGBTQ people are especially at risk to lack of care or support from family. Today's webinar, which is being held in coalition with the Human Rights Campaign, SAGE, and Lambda Legal, seeks to provide some guidance and information on the coronavirus and its impact on LGBTQ older adults. Our goal is to provide tools, supports, and solutions in navigating this pandemic. We hope that you find this information useful, and thank you for joining us.
All right. Hey there, I'm Aaron Tax, the Director of Advocacy at SAGE. I use he, him pronouns. And today I'm going to talk about the challenges that LGBT older people and older people living with HIV already face, and the ways in which they are exacerbated by COVID-19. Even before this crisis, LGBT older people were already more socially isolated than the population at large. As you just heard, they're twice as likely to be single and 4 times less likely to have kids than their heterosexual and cisgender counterparts. So when we talk about staying at home and quarantining as an older person, this is all the more difficult when A, you have no one else at home, and when you don't have the family support network in place to check on you. Many LGBT older people are disconnected from their families of origin, and instead are reliant on what are termed families of choice, friends and others on whom they rely and treat like family. Unfortunately, many are of the same age or don't live with them, so it's even harder now to stay connected to or supported by families of choice. Plus, now many LGBT older people are unable to access those few places where they once congregated in a group setting, where they felt welcome, where they could get the services and supports they need, like our SAGE senior centers across New York City. In addition to that, many LGBT older people have higher rates of poverty than their heterosexual and cisgender counterparts, especially at this time when layoffs are rampant, that extra paycheck isn't coming in, or people aren't able to rent out that extra room on Airbnb. Already meager resources may be even more slim. A number of older people we serve in New York City are homeless. They rely on meals at senior centers, and when that ended, they relied on grab-and-go meals. Now those programs for seniors have also ended. It's a constantly evolving situation, but it gives you a feel for the types of challenges we are currently seeing. Lastly, LGBT older people have historically been reluctant to seek care, services, and supports because of a lifetime of facing stigma and discrimination. While LGBT older people on average have worse physical and mental health situations than their heterosexual and cisgender counterparts, nearly 1/3 have delayed or foregone needed medical care because of past experiences of discrimination. In sum, we know that older people are an at-risk population during this time. We know that they need to be able to seek care, services, and supports to stay safe and healthy. It's not the time that LGBT older people or anyone else should be weathering the crisis alone. They need to know that they are protected, and it's more important than ever that we double down on making sure that this population does not feel invisible. And with that, I'm going to turn it over to one of my colleagues, either Serena or Cheryl, to take it from here.
I think if we could advance the slides. There we go. So my name is Cheryl Wayland, and I'm the Director of National Education Initiatives with SAGE. And one of the projects that I lead at SAGE is the National Resource Center on LGBT aging, and my pronouns are she, her, and they. You know, as we get started today, we're going to be learning a lot about our legal rights. And, we're focusing on planning and preparing as well. There's a great deal that one can do for oneself and others to plan, even during this time of crisis. At SAGE's National Resource Center on LGBT Aging, we've compiled a listing of documents to help navigate this planning process. And I'll briefly highlight some of the resources that are available on our COVID-19 resource page, which can be found at lgbtagingcenter.org. One of the first documents that we have is one called Prepare for COVID-19. And this is a fact sheet that provides tips and resources to assist with planning. One of the most important things that we can help connect LGBT older adults to today is their area agency on aging. Through our area agencies on aging, which are highlighted in this resource document, you can actually help older adults sign up for nutrition services and other services that they may need today and in the future. So I really encourage folks to look at this document and see what may be available to help the older adults in your networks. The next resource that we have is one called COVID-19 Resource Listings. This is actually a growing list of resources across the country. And as we learn of new fact sheets that have been developed, new resources that may be coming online to support older adults across the country, we'll be updating this document as well. So we encourage you to check this document on a regular basis to see what new resources may be available. We've also worked with Consumer Voice and Lambda Legal over the years to develop a resource called Residents' Rights and the LGBT Community. We know that many of our LGBT older adults are living in long-term care communities today. And we oftentimes wonder, what are our rights as an LGBT person in long-term care? This document really helps to explain what those rights are. And it's important to know that the Ombudsman network, which is across the United States, is actively working today to ensure that residents' rights are still being protected in nursing homes and skilled living communities, even during this time of crisis. So I encourage you to take a look at this document, especially if you have LGBT older adults living in long-term care communities today. And then another document that we worked on along with National Consumer Voice is a document called My Personal Directions. And this is a form that allows people to document what their wishes are and what their needs are should they go into a long-term care setting or a healthcare setting. And it's really important that people understand what we want. And so this will help people to really lay out what their needs are and what their wishes are. It's never too late to start planning, and we really encourage people to take this time to see where you can strengthen your own planning process as well as your networks that can support you as you age. I'd also like to briefly mention another project that we've started with the Human Rights Campaign Foundation, which is our Long-Term Care Equality Index. This is a new program which will be working with long-term care communities to help implement LGBT inclusivity, which is a critical need across the country today and in the future. You can learn more about this project at thelei.org. So I would encourage you to check that out when you have time. And I will now turn it over to our colleague, Serena.
Hi, everyone. Serena Worthington, she and hers. I hope you all are well. I'm pleased to be joining you from my home in Chicago. And thanks to Erin and Cheryl for queuing me up. I'm here to share some of the changes at SAGE and with our affiliates that we've made and launched in response to the pandemic. So during normal times, our work is done in and through the 5 SAGE centers in New York City and through our 30 affiliates in 22 states plus Puerto Rico. With these programs no longer able to provide in-person services, SAGE and our affiliates are developing innovative ways to deliver essential services and supports. At SAGE in New York, in coordination with our local partners, we're providing life-saving home delivery to hungry elders who otherwise would not have access to healthy food. Each day, SAGE staff are calling more than 2,000 older New Yorkers to meet their emergency needs, conduct welfare checks, and connect elders to necessary resources. SAGE also operates the National LGBT Elder Hotline. It is available 24 hours a day in English and Spanish, and it's answered in English and Spanish, and on request, you can request a number of other languages. That number is 877-360-LGBT, and that'll be on a slide at the end of the presentation. SAGE is also working to fight isolation and keep our constituents connected through a virtual SAGE Center that we're simultaneously building and launching that will offer support groups, classes, and activities. As I mentioned, we are connected to our affiliates across the country. They are serving LGBT people in every region in the United States. Like many on this webinar, SAGE affiliates and our partner organizations have pivoted to online programming and check-in calls using some of the most common platforms like conference call platforms for phone-based touches to video-based platforms like Zoom, Facebook Live, and Instagram Live. I'm excited to be telling you about another new initiative called Sage Connect to address the national crisis of crippling social isolation among our LGBT elders. Sage is launching on an emergency basis a national virtual volunteer program called Sage Connect, which would connect people at home with the many volunteers from our community who are stepping up to the plate. It brings together these altruistic and compassionate volunteers who are eager to make connections with those who feel isolated, for like a weekly chat or a text chat if folks prefer, which will be a lifeline in avoiding isolation and a link to help. So we'll launch that in the next few business days. Thank you and be well, everybody.
Hi, everyone. Thank you again, Cheryl and Serena and Aaron. That is such valuable information, and we're very excited to be partnering with you on this going forward. So as we face this expanding pandemic, there is much that is unknown and that is out of our control. But as the coming days unfold, I did want to provide information on a series of actions that you can take now to protect yourself and your family and your friends as you navigate the system and potential health problems. And so first, I think it's very, very important that you make a care plan. Knowing that the healthcare systems are going to be overwhelmed and really strained, making sure, for example, that you have all of your prescriptions filled ahead of time, and using delivery services for those if possible so that you don't have to go into a pharmacy. Identify a support person to call if you do get really sick. And this can be family or friends. This can be a neighbor. A lot of people, I think, are really ready to be called on at this point. If you don't necessarily have someone top of mind that you feel comfortable calling, there actually is a really good resource called the Conversation Project. And you can go to their website. It's in the PowerPoint, and can give you tips on how to start that conversation with people, to get a contact person or a support person, just someone to check in with on how you're feeling in your care, and if you do end up needing to go to the hospital. If you begin to feel ill and think that you might have come down with the coronavirus, contact your primary care provider. It's also a good idea to go ahead and get in touch with them ahead of time, just to reestablish that relationship if you need to. A lot of doctors' offices are doing telemedicine, or just pick up the phone. Don't delay going to the doctor or the hospital if your condition does worsen. Karen is going to get into all of the protections and rights that you do have. It's very, very critical that you engage with the health systems as proactively as possible. And we're gonna try to give you as many tools as possible to make that feel as doable as possible. And so discuss with your provider ahead of time whether you should bring, for example, maintenance medication and prescriptions, including hormone therapy treatments, if you do go to the emergency room. So I did want to talk a little bit about developing your estate planning documents. And we've actually heard a lot about this for all populations. Everyone should have these resources at their fingertips really anyway. It really does take the guesswork out of things, and make sure that you are as prepared as possible. So first, we're going to talk about the durable power of attorney for healthcare, or the healthcare proxy. So what this does is it allows you to designate another person to speak on your behalf if you cannot if you cannot make decisions or if you become incapacitated. If you do need to be on a ventilator, they often do need to incapacitate you, and a healthcare proxy would be a person that could step in and take care of logistics while you couldn't. This document can also go ahead and designate visitors. Currently, as Karen is going to get into, you do have a lot of rights as far as visitors go. But if they are not family, legally family, you can designate that in your healthcare power of attorney, and the hospital has to recognize them. I will say that given the seriousness of the pandemic and the strain on the healthcare system, visitors across the board are not being allowed. So that might not be relevant, at least in this short-term window, but it's something good to have in your healthcare power of attorney. This person also will, be given all of your personal property if you become incapacitated, and is going to be the person who authorizes medical treatment and any surgical procedures. And again, this person absolutely does not have to be a family member. It can be a spouse, it can be a partner, it can be a close friend. And again, if you need sort of support and ideas on how to broach this, obviously, difficult topic, the Conversation Project is a great place to start. The laws do vary state to state on what an advance directive or a healthcare power of attorney needs to look like. And so what we've done here is provide links to the National Hospice and Palliative Care Organization, which actually provides state-by-state forms, which is super, super helpful. And then the American Hospital Association also has a printable wallet ID card that you actually can just keep in your wallet with all of your information to make it super, super easy. And that's also online. So those are two great resources to sort of take the guesswork out of your advance directive. So the living will or a medical directive instructs the doctor or your physician or care provider about your preferences for life-saving procedures if you do become incapacitated and are facing a terminal condition, such as COVID-19. So this is really a critical document to have to communicate your wishes to physicians. It really also protects your loved ones and the people that you pick to be your medical healthcare proxy from any from the big decisions that really are yours and are so important to think about ahead of time. So there are standard things that you're going to want to consider about life prolonging procedures. If the doctors decide that long-term survival is not going to happen, you can also put in more specific directions. And I would note that most living wills do have information about ventilation and being put on a mechanical ventilator. And often people will choose not to do that if they are facing a terminal illness. What I would say, which is different in COVID-19, is that ventilators are being used much more frequently and people are successfully getting off of them. And so just that's something to consider, and perhaps to talk to a primary care provider or an attorney about what that looks like for you, because it's a little bit different in this bizarre world that we're living in. Also, any spiritual or religious considerations that you have can also go in your living will. So the living will and the healthcare proxy both expire when you pass away. And so the will, and again, all of this stuff is really, really important to have, not just for COVID-19, but for peace of mind going forward. regardless of your healthcare condition or how old you are or how young you are. These are really, really, really great tools to have for you and your family. And so the will is going to state how you want your assets. So personal possessions, money, real estate, if you have that, to be distributed after you pass away. And what I would say is if you don't have access to an attorney, and especially if you are wanting to do this in a tight turnaround in the next couple weeks, there are a lot of online programs and pro bono legal clinics and LGBTQ centers that are very, very helpful. And it's better to have a personally written will that might not be perfect, but again, there are online resources that will provide basics, and each state varies as far as how many witnesses you need, things like that. Call a pro bono legal clinic and ask them. It's better to have something than nothing to communicate your wishes. And I think in addition to distributing any assets or property that you might have, your will can also be a really important tool for in dictating your funeral arrangements and obituary language that you might want to have. So Lambda Legal actually has a really great resource about communicating your wishes for your funeral that's online, and I have a link for that as well. And I think, so now I'm going to turn it over to Karen. Thank you so much, and I look forward to questions.
Thank you so much, Robin, and to all of my colleagues. I'm really glad that we're able to do this together today. My name is Karen Lowy. My pronouns are she, her, hers, and I am an attorney with Lambda Legal. My goal for today is really to empower you or the LGBT older adults or people living with HIV who you are working with and advocating for to navigate this pandemic with less fear about discrimination playing a role in making access to care harder. There's enough fear and enough concern about accessing healthcare right now that discrimination shouldn't be playing a role in your accessing that care and you're getting the help that you need. So just to go super big picture right off the beginning, from the beginning, I want to just say plainly that LGBT older adults and older adults living with HIV do in fact have rights to be free from discrimination in healthcare, including in hospitals and long-term care settings, to have their privacy and relationships, gender identities and choices, relationships, just all equally respected, to direct their healthcare, to decide who's going to make decisions for them, and to decide who can be by their side to the extent anyone is allowed to be by their side, as Robin just highlighted. These are all basic rights that we're talking about. Why am I talking about this in particular, about the role of discrimination here? Really, in every single study or survey that has assessed the experiences of LGBT older adults with regard to healthcare, high percentages of LGBT older adults have reported past experiences with discrimination, out and out denials of care, being provided inferior care, harsh language, physically rough or abusive treatment, unwanted physical contact, refusal to recognize their families, including children, partners, or spouses, let alone family of choice, and otherwise being treated by healthcare providers who were unaware of the specific needs of LGBT patients or people living with HIV. This discrimination has been experienced by vast majorities of respondents, but at an even higher prevalence that has been experienced by transgender older adults. Discrimination also increased for LGBT people and people living with HIV who may also experience discrimination based on other factors, including race, economic status, gender, ethnicity, and national origin. The intersection of these aspects of people's identities amp up the experiences of discrimination. And as a result, unsurprisingly, high percentages of LGBT older adults also report concerns that healthcare providers will refuse to treat them because of their sexual orientation, gender identity, or HIV status, and that there aren't going to be enough healthcare professionals adequately trained to care for them. And as a result, many will avoid or postpone care because of that fear. And again, this is particularly pronounced for transgender people. The US Transgender Survey has consistently found that nearly 1 in 4 transgender people has avoided seeking healthcare in the last year because of fear of discrimination or mistreatment. And these fears are fueled by actions of the current administration seeking to undercut and diminish protections against discrimination and to invite those with religious objections to seek exemptions from having to provide care at all. But these efforts have not succeeded, and the laws actually remain in place to protect LGBT older adults and people aging with HIV who will have to interact with the healthcare system because of COVID-19. Those fears are all completely understandable, but our goal today is really to help everyone understand that there are strong legal tools available to protect LGBT people and people aging with HIV from discrimination as you access the healthcare system in the midst of the pandemic. The healthcare system right now is clearly being stretched beyond all recognition, but these anti-discrimination protections remain in place to make sure that there are no barriers related to a patient's sexual orientation, gender identity, or HIV status preventing them from getting the care that they need. So what are these tools? Federal law provides several tools because federal law bars discrimination against LGBT people and people living with HIV in the provision of healthcare under a few key provisions. One, Section 1557 of the Affordable Care Act does prohibit discrimination on the basis of race, sex, which has been interpreted to include LGBT people, disability, or age by any healthcare program or activity receiving federal financial assistance or that's been established by the ACA. And let me be clear, that's just about all of them. We're talking about any entity that receives federal dollars for the provision of healthcare, and that includes Medicare and Medicaid. As I said earlier, you know, the Trump administration has really tried to allow healthcare workers to deny care to LGBT people based on the healthcare provider's own religious beliefs. But the courts have in fact blocked those efforts. Thanks to litigation that Lambda Legal and lots of our colleagues across the country have undertaken to ensure that those anti-discrimination protections remain in full effect. And the need for those protections, of course, is most critical and clearly in the spotlight right now. And I'm going to get into some of the tools that folks have for how to enforce these protections a little bit, but I'm going to keep going through what some of those are. So if we could move to the next slide, please. All right, I'll just keep talking. The slides will come with me in just a minute. So other sources of protection at the federal level. One is the, well, two are the Americans with Disabilities Act and the Rehabilitation Act, which both prohibit discrimination by service providers and those who receive federal money, which again includes Medicare and Medicaid dollars, on the basis of disability, and that includes HIV. The other source of federal law that I wanted to point to is something called the Federal Nursing Home Reform Act, which applies in long-term care settings. I think it was Cheryl who alluded to a joint publication that we'll make available to folks that addresses exactly how that law plays out for LGBT older adults. But what the Federal Nursing Home Reform Act basically does is that it sets a baseline of protections in long-term care settings that apply equally to LGBT older adults, including rights to privacy, respect, choice, to be free from abuse. And our publication lays out specifically what that looks like, how that is concrete in terms of the rights to privacy and respect and choice about people's identities and their ability to retain autonomy over their decision making and have access to information, and all of that good kind of information. Beyond the federal protections, and please forgive us, we're clearly having a little bit of technical difficulties, which we're now back up and running. Awesome, thank you, Kendrick. So actually the next slide starts to talk about protections available at the state level. So Nearly half of the states bar discrimination against LGBT people in public accommodations, which regularly includes healthcare providers, as do hundreds of municipalities across the state. Many states also have a patient's bill of rights and a resident's bill of rights, similar to the Federal Nursing Home Reform Act, that apply to healthcare and long-term care settings. State licensing requirements for healthcare facilities and providers may also include non-discrimination requirements. And then there are independent bodies that accredit and certify healthcare organizations, including the Joint Commission, which is one of the most established authorities, and which has a policy prohibiting discrimination, including based on sex, sexual orientation, gender identity, and disability. So all of these various tools provide sources of protection for LGBT people who may experience discrimination in healthcare. So what exactly does that mean? What does it look like to be free from discrimination? It means you cannot be refused treatment or given inferior treatment because you are LGBT or living with HIV. And people's sexual orientation, transgender status, or HIV status cannot be inappropriately considered in assessments about who gets access to life-saving care. It means you have the right to be addressed by the name and pronouns you use. You have the right to be housed and to use facilities consistent with who you are. You have the right to clothing consistent with who you are. Again, to the extent you're still present, able to wear your own clothing rather than hospital attire. It also means that you have control over who gets to visit you, assuming that's anyone, as Robin indicated, and when you have taken the steps that Robin identified to designate a healthcare decision maker, you have the right to have that designation respected. There's a 2011 regulation that requires that healthcare facilities and long-term care facilities that participate in Medicare and Medicaid, they are required to respect the rights of patients to designate visitors. And that includes who gets to visit you and who does not get to visit you. Again, assuming anyone does. And that hospitals can't deny visitation privileges or refuse to respect people's documentation that lawfully authorizes alternate decision makers based on factors including sexual orientation or gender identity. So those are some of what it means to be free from discrimination. The question then happens, then what do you do? What do you do if you do experience discrimination? You know, as we said at the get-go, these rights are there, but that doesn't mean you won't experience discrimination. Recognizing that if you are interacting with the healthcare system right now, you're already ill, you may not be at your most able to advocate for yourself. But here's some steps that you can take. The first thing is to speak up to the extent you can. Calmly and firmly tell the person who's discriminating against you that it is not only wrong, it is unlawful for them to discriminate against you. Report every incident to the appropriate staff. Ask to speak to a supervisor. Contact the hospital's HR department. See if there's a diversity and inclusion point person within the hospital. Take notes. Write down what happened, where, when, who was there. If you can, ask for names of the bad actors and anyone who witnessed it or observed it. Contact information is good too. Get copies of anything the discriminator has put in writing, letters, emails, medical records, and file a complaint, whether that's internally within the healthcare system or externally. The legal protections that I laid out are enforced in a wide variety of ways, whether filing complaints with agencies that oversee and enforce those laws, with licensing authorities. All of these are steps that you can take whether in the moment or after you are on the mend. Some of these issues are going to arise really emergently and immediately, and that's where we're here to help you. Couple slides down, hopefully we'll be able to get there, are some resources about ways to lay out what your protections are. But the one after that, one more, most critically, is Lambda Legal's help desk. If you or someone you know is experiencing discrimination, you have questions, you're looking for resources, you're looking for connections to lawyers who may be able to represent you, Lambda Legal's help desk is available to provide exactly those information and resources. Calls can be taken in English or Spanish, and every inquiry is strictly confidential. Now, I know a lot of folks are feeling like, if I'm in the hospital because I'm dealing with coronavirus, the last thing I want to do is get a lawyer involved and have to fight about this. I just want to get the care that I need, and that's totally right and fair. Calling Lambda Legal does not mean you're filing a lawsuit the next day. Our goal is to provide you with information and resources to be able to advocate for yourself in these incredible moments of vulnerability. And yes, we're lawyers. We like to sue. We like to make sure the system is corrected and it's fair and it's right. But the help desk is there specifically to provide you with the information that you need to be able to advocate for yourself. And if that's a road you want to go down, to provide you with connections to make sure that that can happen. So with that, I turn it back to my colleagues for questions.
Great, thank you so much, Karen. And again, sorry about the technical problems. This is the new world we live in of working from home. So thank you, it's very, very useful. It looks like we have one question typed in to the question and answer portion, and that is about the blood ban, which is the current FDA policy barring gay and bisexual men from donating if they've had sex, if a man has had sex with another man within the past 12 months. The commenter is exactly right. This is not reflective of the current science. We know that the nucleic acid test, for example, can get results very, very quickly, within days, not 12 months. And we are, I think all of the organizations are working to advocate for changes. We have for a very long time. And unfortunately, it's the FDA moves extremely slow and deliberately because they are blood scientists. It's an unfortunate discriminatory impact of a blood science decision that we are absolutely in support of additional research and changing to reflect the science that exists. I know that there's also been some action in Congress recently. Several senators have sent up a letter really pushing the FDA to move more quickly, given the research that we already have and the epidemic that we are facing. And so hopefully we will see more movement on this than we have in years in the next months, hopefully. So I know that HRC has stuff on our website. I'm sure that Lambda does.
Yeah, absolutely.
So we would love to get you guys involved. The next question, was Iowa missing from the map? I am not sure, but we will look into it. And if it is, we will fix it and get that done. What do you do with a living will when you don't have any friends or family? So the living will, again, you don't have to designate friends or family. It really can. It can be a neighbor. You can also say, put in your wishes as far as life-saving care, as far as CPR and resuscitation and ventilation, and just be very clear to doctors what your wishes are to take out the guesswork from them. So the best case scenario is that you would have someone that could make medical decisions for you. If you don't, you can be extremely clear in the living will and trust physicians and nurses that are professionals and experts and compassionate to make those decisions, to apply those decisions that you've already made. And where do your assets go? It depends on your state. If you truly have no one, they might escheat to the state. I'm looking at Karen, is more
happy to jump into, Robin.
What's that?
I said I'm happy to jump into.
Go for it.
Okay, super.
I'm talking about escheating to the state, so I'm going to.
Robin's going back to law school.
Yeah.
So 100%, it is, it does depend by state. Every state has a law that largely tracks either blood or legal relationships, which is among the many reasons I think for folks who are estranged from your family of origin, doing a will is a really important thing to do. I often have clients say to me, I don't have anything. I don't have anything that I could will away. And I say, well, what's important to you? Do you have photo albums? Do you have books? Do you have jewelry that's not, financially valuable, but is important to you that you would want to make sure goes to somebody? That's what a will can do. A will just gives you control over what happens to your stuff, whatever that stuff is. If you truly pass without having any blood relatives next of kin or relatives at law, then yes, then things go to the state in terms of finances. But they will, courts will try hard to find whatever family of origin they can find.
It looks like, is there a way to get copies of these policies to my children? Absolutely. It's important to share all of this information so that nobody is sort of sidetracked or sideswiped at all. So we definitely encourage you to have these conversations with your family, with your children, with your friends, making sure that everybody is in the know ahead of time. Other panelists, feel free to jump in on the on the slides. Yes, the webinar is going to be available, and I know that Sage is going to be posting it on the National Resource Center. I'm sure that Lambda will and HRC will as well. We have an HRC COVID response page where all of this information is going to be, and I believe it's actually going to be on our YouTube channel, which is extremely accessible. Again, panelists, feel free to jump in if I'm going slow. Okay, so let's see.
Well, so one question I see is about whether it's wise to relocate in advance to an area with resources, acceptance, and services, and how to sort of assess the LGBT cultural competency of healthcare providers in your area. I will defer to my colleagues on the cultural competency piece for how to assess it, but I want to be clear that a lot of the legal protections that I'm talking about do in fact apply nationwide. The Section 1557, the Americans with Disabilities Act, the Rehabilitation Act, the Federal Nursing Home Reform Act, these are nationwide laws. So how culturally competent the particular healthcare facility is absolutely something people are worrying about and thinking about in advance, and preparation is definitely key. I agree, for all of the reasons that Robin laid out, but please know that these tools are there to protect you no matter what part of the country you are in. And frankly, as we are increasingly seeing restrictions on people going from one place to another within the country, as someone who's in the New York tri-state area, I mean, at this point, just about the rest of the country wants me to stay away. I think we're already seeing, the healthcare systems in lots of areas being incredibly, overtaxed, and the in many ways the course is to really advocate for yourself wherever you may be, and know that these tools are there for you to protect you.
And I see that there's actually a specific question about Puerto Rico, and Karen, please correct me, but all of these protections should apply in Puerto Rico as well.
That's right.
And hey, this is Aaron. I also see a question here that asks about where you can look to find out what the rules and laws are on your state. So I know the LGBT Movement Advancement Project, LGBT MAP, if you Google that, has lots of good maps, not surprisingly, that talk about and show the different non-discrimination protections based on where you live. I think HRC might, I believe, I'm pretty sure it has pages too, where you can drill down and you can pull up your own state and find out what the protections are there as well.
Yeah, map is actually where that map came from.
Oh, there you go.
Their logo's on it to give them credit for sure. They have great resources. And yes, Lambda Legal also has state-by-state protections on our website.
This is Serena. I'll chime into Bob's question. Serena, with the virtual volunteer hotline and the call Sage is currently making in New York City, do you know if HIPAA restrictions have eased on giving contact info to volunteers who are calling homebound seniors? The Sage Connect's a voluntary program that folks are joining, not from our case management load. So it's the person who wants a call just volunteers to get a call, and the person who wants to make a call volunteers to make the call. We do have a waiver that both parties have to sign, and we're doing some training of the volunteers just so that they understand some boundaries, and we're providing a essentially like a this is what this is guidance for folks who are on the caller end. Thanks for the question, Bob.
Oh, Karen, you're muted.
There we go. I do see a question about what are the rights for LGBTQ patients at private facilities, and raising the Samaritans facility in New York to play that out. There's a pop-up hospital in Central Park that is actually been built by Samaritan's Purse, which is in a nonprofit run by Franklin Graham, who is asking all volunteers to sign a pledge that they are Christian and they don't like LGBT people, which is definitely very concerning. But all of the laws that I'm talking about, all of these anti-discrimination laws that apply to healthcare providers apply to those folks too. The reality is that if Section 1557, it applies to all recipients of federal funding, which, you know, just about every healthcare facility you can think of takes Medicare and Medicaid dollars, and that is included within that. As well, in the state anti-discrimination laws in New York, for example, both the state non-discrimination law and New York City's non-discrimination laws bar discrimination by any entity that provides services to the public. That's what a public accommodations law is, that is explicitly protective of LGBT people. It is illegal for these facilities to turn people away from healthcare. And if folks are hearing about that kind of discrimination, they should absolutely contact our help desk. And just one other thing that I would say, you know, the question of who would want to be treated or cared for by people who don't want to accept or respect them for who they are, totally fair and real question. And the reality is that most people don't have a lot of choice about where they get their health care. You know, major metropolitan areas may have multiple healthcare systems, but lots of the country does not. And so it's really, really important to emphasize that these protections apply in every one of those places. So if you don't have a choice about where you're going to go, and frankly, if you are incapacitated enough that the ambulance comes and picks you up, they're going to take you to the place that they know is available the fastest they possibly can. So it's really, really important for folks to know that you have these tools at your disposal if you are taken to a place that is not going to be respectful of you. They are in fact required to.
Well, great. I think we are slowing down on questions. Can you, there's one more, can you simply amend your current legal documents to include COVID-19 treatment language? Again, I'll look to Karen on this, but I see no reason why you would not, Karen.
No, I don't see any reason why you wouldn't either. The thing just to remember is that every state has particular requirements for what those documents are supposed to look like. Sometimes you need to have witnesses when you sign them. Sometimes they need to be notarized. So if you're going to add in something to a document that was previously executed with all of those formalities, all of those requirements, you need to make sure that you observe them again, even when if you're just adding something in that's specific to the current moment.
Okay. So great. So thank you so much for joining us. I believe that all of our emails are accessible. There they are. Again, this PowerPoint will be available. We all have extra resources. We would love to hear from you and to be a resource for you going forward. So thank you so much, Sage and Lambda, for joining, and for Kendrick, our legal assistant, for doing all the technological things. So thank you so much again. Everyone stay safe and be well. Thank you.